I'm Guido Rubboli, professor of clinical epileptology at the University of Copenhagen and senior consultant at the Danish Epilepsy Center in Dianalund in Denmark. I am one of the organizers of this Dianalund International Conference on Epilepsies. This is the 6th edition. It was the main topic that we discussed in these 2 days was the correlation between the clinical presentation, we call it phenotype, with the genetic background, and why some conditions share the similar phenotype in spite of the fact that they have different genes and vice versa. We are very happy about the conference. Myself and my co-workers, co-organizers, we attracted people from all over the world, about 200 participants, including the speakers. And we discussed the most recent advances in research in genetics and treatment in several types of epilepsy. We hope that this has been for us and for this participant as a sort of forum to exchange ideas, to gain new knowledge, and also to be inspired for further work and further research.
Hi, my name is Matthias. I'm from Belgium. I've worked a while in Dianalund in Denmark. And I presented today in this conference our work about foraminoglyburidine in KCNA2, in which we've seen very good results in patients with epilepsy and also with movement problems. This is a very nice conference to be, and I really enjoyed it.
Is there anything that you might have learned at this conference that you didn't know before, or things that you can apply in your work?
It's very important to collaborate all together. Electrophysiologists one part, clinicians at the other part, to integrate like basic science with the clinicians. So I think that's the main message of conferences.
I'm Cinzia Scarcelli. I'm from the SNED Italy and the European Federation. I feel this conference is very great because it's sharing lots of information about how different monogenic epilepsies can overlap and they can have a common pathway. So I really hope this could, push forward a little bit the understanding of the monogenic epilepsies.
So I'm Altair Brito Dos Santos. I'm an assistant professor on the Jean-François mentoring. We just talked to you minutes ago. So we are working in several projects in our lab now, looking at more in the, the basic level to understand the mechanism of disease of some genetic epilepsy. So far we have been working as XBP1 disorder. Now we are also moving for some GABA receptor mutations, and we're really excited to hear more about the clinical part of those diseases so we can translate for our basic research.
And what do you think of the conference so far? Has it been interesting?
It has been amazing because we are basic researchers, so we are more doing experiments in the lab, using more models, and here we kind of meet the neurologists and clinical researchers. So we now are looking at the patient. And that brings a good motivation to keep our hard work in the lab going.